Thank you, everyone. It's a pleasure to see everyone. Thank you again for being here. I got a little background music going on. I'm actually outside of a Starbucks. I'm not having anything from the Starbucks. I'm just using their Wi-Fi. I am drinking a bottle of Topo Chico. I'm in Arizona right now. It's 85 and sunny. I don't want to complain about it being too hot, but it's hot. It's hot. A little bit about me. Most recently, we were living in Colorado. We left Colorado. We went to California for about 6 weeks. We were there we saw the fires in Malibu. We saw the fires in LA. We eventually were down in Orange County, south of LA, and had that experience there. And currently, we are actually tent camping, trying to figure out our next move. We do not want to live in mold, so we are living outside with our 4 children and our 2 cats and our dog, and it's challenging, but it's been a really interesting experience. I believe God has put me on this path, because putting me on this path and me living this path helps me teach others to say, hey, like, this is the way to do it. I've done it, and this is how, could possibly do it. So anywho, that's some of what's been happening with me. We are doing a summit, an online summit through a company called Dr. Talks. We did something similar a couple of years ago. There's 40 different experts on this through Dr. Talks. No bait and switch or anything like that. It's totally free, 40 experts. It's myself and a friend of mine, Dr. Eric Solinsky, who's a chiropractor and a big essential oils guy, who is just absolutely fantastic. So he interviewed a lot of people. I interviewed a lot of people, and so far so good. So again, that's totally free. I've got some mini talks. So I started off every day with some information as well. And then you'll hear from the experts in there. We've got cardiovascular surgeons, cardiologists, and then people who are light experts, sunshine experts, fasting experts, environmental and mold experts. Christiane Northrup is a medical doctor, OB-GYN. She's absolutely brilliant. She was a lot of fun. Another really cool interview I did is with my friend Barry Goldstein, who is a Grammy Award-winning music producer who now uses music for medicinal purposes, really to engage the autonomic nervous system, crank up parasympathetic tone, decrease sympathetic tone in a way to help with heart rhythms, blood pressure, etc. That's what we got going on there. Okay. Yeah, so anybody have any questions about the summit or anything like that? There's a lot of free goodies in there, a lot of giveaways in there. Feel free to get the link and share it with people you love. Sharing, as we tell the kids, right? Sharing is caring. They don't really share, but I hope that you do, and you share with your people who need this. And again, it's just great free information from some phenomenal experts. And there you have it. And again, I want to thank you, Ryan, and yourself certainly, and all the coaches at Natural Heart Doctor who participate in the Facebook group. Facebook has its pros and cons. I think hopefully it's in a pro phase right now, in the sense of more of freedom and less censorship. But that's all we really want, is the freedom to have conversations, the freedom of choice, the freedom of expression, the freedom of speech, the freedom of choice over our healthcare. That's all that we're asking for as well. I'm definitely into making America healthy again. How we go about that is a matter of debate. But again, it's the freedom of choice to choose what you want to choose. And I am a freedom guy, because some things that you take, for example, the banning of food colorings. I'm always concerned about the banning of anything, because what somebody can ban today that we're in approval of, maybe they will ban something in the future that we're not a fan of. So I believe that whenever we give the government the ability to ban stuff, it's like a slippery slope. And yeah, I definitely want to ban, the use of glyphosate and other chemicals that are poisoning the environment. And now you get into this whole debate, but it's just, as far as, maybe they would ban seafood, maybe they would ban regenerative meats, maybe they would ban supplements in the future, maybe they would ban holistic practitioners, maybe they would ban homeopathic remedies, maybe they would ban essential oils. Like, you never know what people are capable, or you do know what people are capable of. That is my opening salvo, but I appreciate everybody here. As you guys know, I love Q&A. I love to answer questions. I love to go on a riff about all these things. And a lot of people have their audio off. If you want to put your video on, that's perfectly fine. So I can sometimes put a face to some of the names. If you're having a bad hair day, I'm not having a bad hair day. I'm having a hair day, the few hairs that I have. It's funny because I remember Joe Mercola was talking about this many years ago, where someone would say, "Oh, if you're so healthy, why'd you lose all your hair?" And I wasn't born healthy. And Jack Wolfson certainly was not born into the healthy lifestyle. Jack Wolfson, up until the age of 33, was eating McDonald's and deep dish pizza and enjoying too many adult beverages. Anywho, there's bigger problems than losing your hair. So, anywho, that's it. All right. So,
We lost your video, Dr. Jack.
you lost my video.
Can't see you. Oh, there we
I'm
go.
back. Okay. Let me see here. All right, so I'm back in the chat box. And so Alita is saying, did you mention your background as a cardiologist? Real quick, if you're asking me about my background, so my father was a cardiologist. I was born into the conventional cardiology world. I like to say that in my mother's womb, I was listening to cardiology conversations. I would follow in my father's footsteps and become a board certified cardiologist. I would join the biggest group in the state of Arizona. In that big group, I was doing angiograms, pacemakers, dealing with the sickest of the sick as a hospital-based cardiologist. 3 years into that, I would meet the woman who would open up my eyes to real health and wellness through nutrition, lifestyle, evidence-based supplements, etc. And that would ultimately propel me to leave the big group and start Natural Heart Doctor in 2012. So here we are right now. Yeah, that's the story with that. All right, so I know, Ryan, you sent me a bunch of questions that would asked before. Maybe I can just fire off on the stuff that's on the screen, then we'll get into the stuff that was sent in. Margot is asking, how does rheumatoid arthritis affect the relevance of high HDLs? My concern about HDL when it's above 85 is that it actually implies that the HDLs are dysfunctional and not protective. So it's almost like the body is producing these HDLs, which are the scavengers. They're antioxidants, but they're also scavengers. They go around the body and reclaim cholesterol where it's no longer needed, bring it back to the liver for reprocessing. If the HDL, for a whole variety of reasons, is not a quality HDL, then the body tries to produce more of them because it doesn't have that, what's called a positive feedback loop, in the sense of, hey, we got enough produced, so we don't need to make more. It's not getting that feedback, so we make more. That is my concern about that. I don't know if it's an imminent concern, like I would be worried about it, and there's no pharmaceuticals certainly for that, but it's just a matter of kind of the whole picture of everything we do at Natural Heart Doctor: eat well, live well, think well, test, don't guess, evidence-based supplements, biohacking strategies. Jeanette, is it a problem to take Biohacking, natokinase? So these are serapeptase to lower fibrinogen. So the answer typically is no. All that stuff is fine. I've never, ever seen anyone get into problems with bleeding from those things. Someone asked about combining those with a pharmaceutical anticoagulant like Eliquis or the old-time warfarin. That would be overkill. I would not do both of those. I would just stick with the prescription. Jennifer had asked about natokinase with Eliquis. I would not do the two in combination. I think that could potentially be dangerous. But again, it's really not necessary because Eliquis is so strong. So there you go. Fibrinogen can be high is a sign of inflammation. So the liver is producing a lot of this particular protein as just a general inflammatory issue. Should you see a hematologist for fluctuating fibrinogen? No, definitely not. Is there anything you recommend for lowering inflammation and ox stress? Like everything, right? Everyone, if you haven't heard me say this before, I want you to get this quick concept, and this is really important. And Ryan, if we could, let's take the audio from this or the transcription. Let's run it through AI. Let's clean it up and make sure everybody gets a copy of this. Send me a copy, and we can make some good use out of this, because I know I talk fast, and everybody can get a recording of this. I eat, live, and breathe this stuff on a daily basis, so I talk fast here. Every disease outside of that, obviously outside of a traumatic experience, trauma, every health issue is related to two things. So everything that's cancer, heart disease, brain disease, autoimmune, everything is two things, right, everyone? Whenever someone talks to you about any particular complaint, it's two things. Too much of the bad stuff, not enough of the good stuff. It really is that simple. And it's got nothing. I didn't say anything about genetics. I didn't say anything about you being a bad person or bad luck or getting older. I said too much of the bad stuff, not enough of the good stuff. So what do? You get more of the good stuff and less of the bad stuff. And that's going to be your methodology. Now, of course, we can get into the details of what's the bad stuff and what's the good stuff, of course, and we talk about that a lot. Now, the way that we measure our status, that's where the test don't guess comes in. Okay, I think I'm doing a lot of the good stuff, and I think I'm trying to avoid the bad stuff, but how am I doing? What is the measuring stick? The measuring stick can be as simple as like the heart attack risk test, which is an at-home test for oxidative stress. That would be one simple at-home marker that you do not need a blood draw. You don't need a doctor's prescription. You don't need to go anywhere. You do a review call with somebody at Natural Heart Doctor. That's one thing. And then a lot of you have done the comprehensive health assessment test, like the $2,000 granddaddy package of 3 blood, 3 urine in a laboratory setting with hundreds of different markers. So that's where we get into, okay, how am I doing? Like I'm Jack Wolfson. I eat pretty darn good. Like not many people eat better than I do. I wear organic cotton clothing. I avoid chemicals to the best of my ability, on and on. But what are my numbers? That's really where things come into play with that. And Ryan's going to help me out. He can throw links in there because a lot of you are going to ask about links and stuff like that. I hope that insurance companies will start covering functional naturopathic doctors. I think we're likely going to see a lot of improvement in that arena. I definitely do. And there's no reason why that wouldn't be the case. And even if you're like Medicare and you're like, oh, okay, how can we save a lot of money on Medicare expenses? What if we took and we did a study and we had 1,000 people under the care of a holistic practitioner and 1,000 people under standard medical? I don't think it would even be close. I think that us holistic docs would blow it out of the park. So there you go. Best, could you comment on the fasting mimicking diet and possible options for it that are more paleo? Yeah, we interviewed a couple of people from Prolon. They were sponsors of the summit, which is one of the reasons why it's free. And I like the concept of it. I do know that they are coming out with an organic fasting mimicking diet, which is a 5-day program that's purely organic and is still plant-based, but it is certified organic. It's not out yet. I think, as pure as I am, the benefits of their current program outweigh my concerns about the organic nature of it. And they're getting good results, and they have a lot of practitioners who are on board with that. So I think, like anything, you can try it and do it once. And if you like it and you felt good with it, continue. And if you're like, yeah, then that'll be up to you. That'll be up to you. Yeah, Nikki, if you want to ask a question right there, you certainly can. Ryan's adding posts. Yeah, we got that there. Yeah, don't be shy. Jump in. This is your opportunity to pick my brain, if you would. Okay. Anonymous, just got 2 heart stents and the doctors say I should not take vitamin K or natokinase. What are your thoughts? I totally disagree. Again, go with your doctor's advice if you want to. My personal opinion, if you were my patient, I would say vitamin K is not a problem at all. The only time vitamin K is an issue is when you take warfarin. It's not an issue with Eliquis, not an issue with Pradaxa, Xarelto, Brilinta, Clopidogrel. My only thoughts on, like I said before, with the natokinase and some of these systemic fibrinolytics. And remember, the natokinase was born of the idea of streptokinase. So streptokinase was what doctors used in the mid-80s. If someone was having a heart attack, there wasn't angioplasty and stents. They injected streptokinase. It was very effective, but it also led to a lot of bleeds. But it's a streptokinase. We use natokinase orally. Not nearly as strong, but it is studied, and it does have efficacy. I would take it in addition to if I was taking aspirin or another antiplatelet, prasugrel or clopidogrel, the old Plavix, that's fine. But I wouldn't take it in combination with Eliquis, Xarelto, Pradaxa, warfarin, because those are just so strong. But vitamin K, carte blanche, I love our emu oil. Emu oil is the best source of vitamin K2 from a supplement standpoint. Of course, our Kickstart and our Wild Salmon Roe have K2 is only really found in animal products. And soy, that's what we recommend. Emu oil. We're really moving towards being a food first company. Jeanette is asking, what are your thoughts on medication versus ablation for AFib? I would always try natural first. Why do people have AFib? Too much of the bad stuff, not enough of the good stuff. Test, don't guess. Try and reverse naturally. Long-term pharmaceuticals versus ablation. Each case is individual. If it was me here right now, I honestly say I don't, I'm not sure. I'm not sure what I would do. Again, it's individual. So if I had occasional AFib that was controlled on a pharmaceutical like flecainide, I'd probably do the flecainide as opposed to ablation. Um, Ablation, you could die during an ablation. It's not likely, but it's possible. Complications happen, radiation exposure. That's just my 2 cents. That's my 2 cents on that. Dion, is there a way to test to see how much plaque there is in arteries? I don't like coronary CT scans. Most of you know my opinion on that. I don't like radiation. You can always do a carotid ultrasound and check that as well. So you can do a carotid ultrasound. Maybe a center near you does CIMT, carotid intima media thickness testing. So you can do that. How's the vagus nerve related to PVCs? It definitely is. Can we use the vagus nerve stimulator to help with heart health? Yes. Have you seen improvement? Yes. Vagal nerve stimulator can be very beneficial. Truvaga was one you may want to look into, Truvaga, but also just gargle, sing, hum can improve vagal performance, alternate nostril breathing, those kind of breathing techniques. All that stuff is very helpful. Chiropractic care is very good for helping to improve vagal tone. How can you test heart contractility? You can do an echocardiogram. Cardiac ultrasound is the best test for cardiac function. You could do MRI in certain cases, but it's overkill. So I wouldn't necessarily bother with that. If you feel your heart contractility is weak, what can you do? We have a lot of articles and blogs on the website about how to improve heart function. And the echocardiogram, though, would say, okay, what is your heart contractile function? There you go. How does a person switch from a statin to your supplement? Presuming, Kate, you mean Optilipid, you just stop taking the statin drug and the next day you take Optilipid. You could take the two in combination. I would prefer to see your numbers just on our program of Eat Well, Live Well, Think Well, Test, Don't Guess, evidence-based supplements like Optilipid. Pam, I have angina symptoms that come and go. They want me to have an angiogram, but I don't want a stent to help with symptoms. Ultrasound was normal. Why do symptoms worsen some days and then I go a week without them? Could it be a spasm? Angiogram. I do plan to make an appointment. I've already had my call. I'm 59. Don't want to have a heart attack. Yeah, Pam, I think individual attention, because I would just advise you, obviously, you go through the intake process with myself or one of our doctors or coaches. Then you do the most advanced lab testing in the world and see where the deficiencies are. So if you are having coronary spasms leading to angina, is it a potassium issue, magnesium issue? Is it an omega-3 fatty acid issue? Is it a choline issue? Is it a toxin issue? Nitric oxide? So there's so many things that get involved. But it's not that I'm anti-pharma. I'm not a pharma first person. I'm a pharma surgery last person. Pharmas and surgery have a place, but it's at the end of the game, not at the beginning. And my brothers and sisters who currently work in the hospitals and in big cardiology groups, they're still pharma first, which it's just wrong. It's just the life expectancy of an average American is 75 years old for men, and for women it's like 78. So that's not good enough. That's not good enough. He had issues. He's saying he went to paleo and now he's got a gout flare. That does happen. I would just say you really need to cut out carbs. Gout is from carbs. There may be some issues though where you do have some nutrient deficiencies that have not allowed you to process the purines that are found in animal products. So you may want to maybe slow down your approach to paleo, if you will. But most people who follow hardcore paleo, they're not developing gout or any kind of issues with elevated uric acid. Is it possible to control or heal AFib flutter caused by surgeries or a congenital defect like Epstein's anomaly? The answer is yes. Is it possible to control AFib? Yes, we've done that many times. We talk about that in my course. And one is like, if you have AFib, it does likely get worse over time. Are there any tests that give insight into stroke risk? We talked about the chat testing is the most comprehensive. We also talk about the heart attack risk test, which is that at-home urine test for oxidative stress, that if you have oxidative stress, you're at higher risk of a stroke. In general cardiac health, you name it. James, red light therapy, love it, and perfectly safe to use in people who have coronary artery disease, triple bypass or not a problem at all. Charlene, is CHF due to AFib, or did AFib cause the CHF? We don't know. We don't know which came first, the chicken or the egg. On a discovery, we could probably figure out which one was which, but going forward, we just want to do both. Regarding your husband, so he had a cardioversion, they shocked him back to normal. but it didn't last. It's because he's the same person who developed AFib in the first place. If you're going to shock somebody or ablate somebody, you want to make them different first. You want to make them a different. Takes me back to the 70s and, the bionic man. We got to rebuild you stronger, better, faster, make you a better, healthier person. And then a cardioversion or ablation or pharmaceutical will be more likely to be effective. Okay. So there you go. Carol had a TIA, discovered AFib, wants to get off Eliquis. So Carol, again, that's an individual conversation. It's certainly possible to use natural treatment strategies in lieu of Eliquis, but unfortunately, I'm not going to give you a blanket answer. It needs more discussion, but I have done that many times with people. And when you follow the program, you're not going to have another event. Again, it's just about whoever the Carol was who had the TIA, let's make her different. Let's create a different person. Jeffrey has persistent AFib. Yeah, Jeffrey, the longer you're in AFib, the more difficult it is to get out of it. But like I said, if you've got things like oxidative stress, inflammation, you got all these different blood abnormalities, ablation is not going to be successful. It's just not going to be successful. Your AFib will recur in 6 months, 1 year, 5 years, it will come back. So if you can avoid the procedure, the better. Suzanne, I've been reading some stuff, viruses and AFib may be connected. I don't really think so. When medical doctors don't know what the cause is, we say it's a virus. I learned that first day of medical school, certainly first day on the hospital wards and rotations. Why is this? It's probably a virus. Okay, like that shuts people up pretty quickly, but we never discover any virus. We never discover this said virus. Susie, what to do for moderate to severe aortic regurgitation. A lot of things that can be done with that to kick the can down the road on a aortic root replacement, valve replacement. And even if you had to have the surgery done in 2 weeks or 2 months, can we make you the healthiest version of you before the surgery, so you do well during the surgery and you recover best and you live a long, happy, healthy life afterwards. There you go. All right, Janice, multiple vessel coronary artery disease with some vessels severely calcified, knee arthritis. Yeah, here's what we know. People who have osteoarthritis have a higher risk of coronary artery disease. Yes, Janice, they are definitely related. Now, they're not necessarily causative, only in the sense that if you have osteoarthritis of a knee, you can't be physically active. Physical inactivity leads to coronary artery disease. That's a problem. But whatever led to the osteoarthritis also leads to coronary artery disease. So, and there you go. I think same thing really applies to you, Cindy, as well. Again, as far as orthopedic issues. And again, Cindy, I'd go see a chiropractor. I would see a chiropractor who professes to be good at extremities. That's what would be good. Charlene is asking about cardiac cath, to figure out blockages. If you have symptoms, consider a cath. No symptoms, no cath. How was that, Ryan? How was that riff?
That was awesome. You have some questions in the chat again if you wanted to look at those.
Yes. Someone's talking about they purchased a high blood pressure course, didn't have access. Yeah, of course, Scott, we want to make sure you get access. No worries about that. Janet K, CIMT. C as in carotid intima media thickness. You could do that. You could also do a carotid ultrasound if you wanted to get another assessment, and it's non-radiation based, so you could do it. I'm not recommending everybody run out and do it. I prefer the blood tests. Say you got a 50% blockage in one of your carotids. Next, now what? I'm going to recommend the testing, because the testing is stuff that we can see at time 0, make changes, and then check 90 days down the road, for example, and see improvements. We're not going to improve your carotid in 90 days. Not going to happen. Which also makes me think too, Ryan, about just reiterating to everyone, about a year ago, there was a study that was released that showed that people, when they looked at carotid artery plaque under a microscope after people had surgery to scoop it out, called a carotid endarterectomy, they looked under a microscope, they found that 2/3 of those people had evidence of visible plastic, called microplastic, in their arteries. If you had microplastic versus those who didn't, you had triple the risk of heart attack, stroke, and dying over the next 3 years, which makes plastic a bigger risk factor than smoking, drinking, blood pressure, and diabetes combined times 2. So
Wow.
plastic is big. Plastic is really big. Okay, so what else? What else? What else? Yeah, Janet, you're talking about, you saw an integrative cardiologist. They talked about taking Crestor, blah blah blah. But people ask me, they're like, where can I find a doctor like you in Buffalo, in Minnesota, in Portland? I'm like, there's only one of me, and there's only one Dr. Lauren Latanza and one Dr. Tanya Rainier. I don't know what to say. Like, if I think I'm the best, I wouldn't tell you to go see somebody else just because you live in New Hampshire and they happen to be located in Connecticut. We got the ability to do a Zoom call. The times are different. This is not the 1970s where you couldn't do the stuff that we do from a distance. For emergencies, go to a local emergency room. Hi, Bill Smith here. Take care of me. Who's your doctor? None of your business. Take care of me. I'm having chest pain. Help me out here. Patricia, can mold cause AFib? All day long. Mold can cause anything and everything. And so, yeah, Nikki, again, I think our methodology, eat well, live well, think well, test, don't guess, evidence-based supplements, biohacking strategies. You did not have a heart attack because you were deficient in Lipitor. Oh, hi, Nikki. Yeah, the reason you had a heart attack is because you weren't taking enough statins. So you weren't taking a statin. Oh, really? That was the cause? No. There's always causes. And a deep dive lab testing in order to prevent this again would be the best strategy. So looking at environmental toxins and pollutants, things like LP little a, homocysteine, intracellular K2, omega-3 fatty acids, like hundreds of different markers, because take these drugs and good luck. That's not a good strategy. It's what most doctors recommend because that's what most doctors are taught. If you guys have heard me say this before, if you take me to France and I'm walking around and people are speaking to me in French, I'm going to look like a total idiot. I'm not a total idiot. I just never took French. And that's the concern I have with the medical doctors. They're not unintelligent people. Of course, they're intelligent. They're extremely intelligent, but they only know what they've been taught. And I was only awakened to this epiphany, obviously, by the grace of God, to bring the woman who will become my wife to me. And here we are. Sandy's talking about her husband with cardiac issues, defibrillators. There you go. Flow for hypertension. Yeah, flow is a natural blood thinner, Jennifer. There is evidence on natokinase and blood pressure, but it's not one of my top blood pressure strategies. I definitely recommend taking my blood pressure course. I think it's $7. It's so packed full of information. Again, Patricia, mold does definitely cause AFib. Thoughts on thiamine deficiency playing a part in heart failure, Dr. Derek Lonsdale's work. This actually goes back to really the 1700s, 1800s, where people were known to, alcoholics, for example, were known to be deficient in thiamine. So the condition was called Barry. It was I-B-E-R-I. That was common in alcoholics, and it's from a thiamine or vitamin B1 deficiency. When we test people's thiamine levels, they are often low, and we do recommend thiamine to those people. For the most part, though, I'm trying to replace it with food like Kickstart My Heart, which is very high naturally in vitamin B1 and all B vitamins because it comes from bison heart. So eat heart to get heart healthy. I have not read the book of Dr. Derek Lonsdale. I know people who have, but again, is the answer as first option a synthetic B vitamin? No, I think it's the foundational things. Retest if B1 is low, then you can take B1 supplementation. If you can't do it with food, then you can do it with supplementation. Patricia, how can I stop metoprolol and losartan? Again, take the blood pressure course, work with us. I'm not going to tell you to stop cold turkey. We got to do that carefully, methodically. Statins, I could stop just by a snap. Pharmaceutical blood pressures may take a little bit of time. Brenda, again, heart failure information, tons of stuff on my blog about my natural treatment strategies to blood pressure. And Tina talked about valvular disease and calcification and stuff like that. I think Artery is a good adjunct to that. And then ultimately, for the 20th time tonight, right? Eat well, live well, think well, test, don't guess, evidence-based supplements, of which Artery definitely is one. Another thing in particular I would look at, Tina, if you're like, okay, listen, dude, I don't want to take all you read everything about this. Give me one more tip. I do like our Body Bio PC, which is that phosphatidylcholine. I think that'll go a long way towards helping that heart. Mold and autoimmune, just if you have mold exposure, if you have autoimmune, how is statin the answer to that? Isn't that the dumbest thing we've ever heard of? It's if I took a hammer and I was hitting Cindy Barone on the toe with the hammer, she wouldn't say, can someone give me a Tylenol? Can someone give me a shot of whiskey or a little bit of fentanyl and morphine? She would say, stop hitting my toe with a hammer, or she would run away. So you run away from what's causing the pain. You run away from what's causing the disease. You stop what's causing the problem. You don't say, give me an aspirin for that, just as if you are mold toxic and you have autoimmune, we got to do deep discovery to figure out why. It's so obvious, but I'm guilty of practicing this way for many years. Again, I was born into this. There was, how could there not be any time in medical school, residency and fellowship? I spend 10 years in medical training. I'm 3 years on the job until the day I meet my wife. How did I kick myself? How did I not ask? What's really the best diet? What's really the best lifestyle? What about environmental toxins? It's just, and it's in the medical literature. It's all in the medical literature. DJ, is it worth going out to Scottsdale? Yeah, it's definitely worth it, especially not to bag on cold weather towns like I'm from in Chicago, but if I'm living in Chicago, although I think weather goes up and down, but if I'm in Chicago in the middle of February, I'm thinking it'd be nice to go out to Arizona and see somebody and get the lab testing done and get a little suncation.
Actually, doctor, I did that and I was commenting that it is worth it to do that.
Oh, cool. Awesome.
Okay.
Thank you. Oh, so I'm sorry. So it is worth doing it. And DJ, where are you based out of?
I was in Denver, but now I'm in Charlotte.
Yeah. Again, it's especially Denver this time of year to be able to come down to Arizona, see our place. Listen, and we do also offer some pretty cool biohacking stuff at our office. Dr. Keith Smeagol is in our office. He's our nurse practitioner in the office who is a physician, and he's been trained in things like exosomes, which is next level stem cells, which is for regeneration. He injects them into joints, injects them into veins, great for heart function. It's a big investment to do, but you don't have to fly to Panama for some aborted fetal tissue stem cells or umbilical vein stem cells. You actually get these exosomes that are the finest quality products in the world. He also does IV EBU, or what's called blood ozone oxygenation. That's very cool. We just talked about Body Bio PC, which is oral phosphatidylcholine. He actually does IV phosphatidylcholine, does some other cool IV stuff. Definitely an investment, time, money. But I've known that dude for close to 20 years, and he's salt of the earth guy, kind of guy who, if you could, like the friend who you could call in the middle of the night and be like, I need an IV, or I cut myself and I need some stitches. Like that guy would come over and do it without even a question. Cool stuff there. Kathy loves AZ. I love AZ too. Today it must have been like in the low to mid 80s. It was hot. The nights are absolutely gorgeous. I can't speak to how it is next week. Next week it could be snowing. I have no idea. Probably not snowing. Yeah, Mindy, my husband is working with your team and stopped his statin, but his cardiologist and family doctor are upset. Of course they're upset. You're going against their wishes. Doctors don't like to be challenged. We do have this often called God complex, but we're not God. And there is only one God, and God built us perfectly. And when we give the body what it needs and take away what it doesn't, that's the strategy. And God did not make us deficient in statins or stents or bypass surgeries. Don't get me wrong, there's a time and a place for emergency procedures. And there you go. Yeah, Dale, it's 81 right now. I'm sitting outside at Starbucks. It's having a t-shirt. It's absolutely gorgeous. Tina loves the recipes. You made the honey dark chocolate fudge. Oh, cool. Yeah, that's a recipe that, frankly, that I created because I wanted to make it. I'm like, I always liked fudge. For some reason, I was dreaming about fudge, and I'm like, I used to like that as a kid. I wonder if we can make it in a paleo format. And it turned out really well. It's cool that it's sweetened with honey, too, because I think honey is just a wonderful sweet. If I was trying to lose weight, I would not be consuming honey. But if I was at my ideal weight, I think honey is phenomenal. Loaded with vitamins, loaded with minerals, other immune stimulating factors. And of course, I'm talking about quality honey. I'm not talking about something in a plastic teddy bear, which you all know already. Anywho, what else, y'all? This is super cool. We got a lot of people on the call. We got over 60 people here. I love this. I love this interaction. Love the questions. And again, I appreciate your participating in the Facebook group. Again, I think that Ryan is wonderful in the group, and there's times when he'll reach out to myself, the other doctors, the coaches, and get answers from them, opinions from them. It's also great when you speak to it and someone's, hey, I'm dying for a natural recipe over here that'll satiate my sweet tooth. And then someone else comes on and they're like, yeah, I just did the recipe and I loved it. Is there anything that can prevent plaque on an artery and breaking away and causing a stroke? Again, everything we do is going to be helpful. In particular, I recently wrote an article about arterial and carotid plaque reversal, and they have data from that. Brenda's Entresto still safe if you have heart failure symptoms with pitting edema and fluid retention, low blood pressure. You got to be real careful with Entresto and your blood pressure. If your blood pressure is low, you got to be real careful with that. Henry, if you're taking clopidogrel, you can pretty much take any supplement. There's really not much of an impact you're going to have with that. The question is how long you need to be on a stent. I usually leave my patients with, how long you have to be on clopidogrel post-stent. I usually say 6 months. Other doctors say a year. Some doctors will say forever. Mindy, Ryan is perfect in this role. Don't give Ryan a swollen head and ego. Be careful. No, compliments are always appreciated. And Ryan is super. That's why he is in this role. So we're good. What are the long-term results of going with NHD versus conventional when investing a lot of money? Love all the wealth of information. So Kathy, I like to say, listen, life expectancy in the conventional world is 75 for men, 78 for women. That's obvious. You can go on to the internet and find that on every single source. Natural heart doctor, I've often called the home of the 100-year heart, but I don't like to limit that. I don't like to limit to any particular number. So I've not really announced this, but I'm thinking about changing the 100-year heart kind of mantra to the eternal heart. And the eternal heart does go along with more spirituality with God, and when we believe in Yeshua, Jesus, as our Savior, and I'm exploring this, guys. This is not what I was born into, and I'm working on this, but I do love the idea that we are taking care of our bodies physically and mentally and spiritually for the eternal. Just to toss that out there, that commentary. But that's where I'm going with this. That's what I'm digging. But I'm telling you, it's just life expectancy in our human earthly state for men, United States, best medical care in the world, 75. Women, 78. If you're okay with that, stick in the mainstream medical model. You're not okay with that, that's what we're here for. That's what we're here for. Yeah, Julie Miller, red light therapy, there's data on that because the dermatologist doesn't know it. That's their problem. Infrared heat saunas, the most amount of data on saunas comes from the good old-fashioned sweatbox. And with the people in Finland, and they've studied this extensively on hundreds of thousands of people, they found that people who sauna from 4 to 7 times per week compared to those who sauna once or no times per week have a 70% lower risk of dying in a 20-year period. That is massively effective. The red light therapies, and I'm not aware of any downside outside of time and money to do. Margot, puffy eyes, circulatory, no. Puffy eyes are allergies. Puffy eyes are from mold. Puffy eyes are from violations of eat well, live well, think well. The potentially future eternal heart method. But I will work with some people so as not to step on our creator's toes when I'm coming up with my methodology. So it was something my wife said to me at church a few weeks ago on a Sunday. She's like, "What about the eternal heart?" And I'm like, "Oh, that's pretty cool." So whatever. That's my take on that. So yeah, Dale, the literature is abundant on people who believe in a creator, people who have religion, people who are faith-based, live longer, live better. That is very clear from many studies. That's just it. Not following that path, I think, would be foolish. But again, I also believe in everybody's individual exploration, and I'm not here to. I do push my obviously my beliefs on everybody. That's what I do. But we should be respectful, most certainly, in people's positions. And we're in the year 2025 right now. We're having difficulty, I think, in a lot of cases, just taking a deep breath and having a conversation. Like everybody's so amped up and ready just to go immediately to battle. Like, why can't we just take a deep breath and say, let's just talk it out. Let's just talk it out and do more listening. They would say that God built us with 2 ears and 1 mouth, so do more listening and less talking. So thank you, Debbie, for that. That really, and I enjoy to see that. You and Dr. Heather make a fabulous team, for sure. Thank you so much. If you're uninterested, low blood pressure, what is low blood pressure? Low blood pressure is whatever number that you don't feel well at. So low blood pressure for Dale may be 88/54, and for Sandy, it may be 96/56. Like everybody's different, but when your blood pressure is low, if you feel lightheaded, fatigued, woozy, like you're going to pass out, that's a problem. High blood pressure is a problem over years and years. Low blood pressure is an immediate emergency. Big difference. Big difference. Error on the side of high blood pressure versus low blood pressure. You never want your blood pressure to go low. Ever. Brenda, a lot of things can cause pitting edema. I know lower extremity compression stockings can help with pitting edema. Different types of combinations of diuretics can be helpful as well for that. Simple leg elevation can be helpful for edema as well. Of course, cutting back on sodium intake would be another, especially just like Morton's table salt, like bleached table salt. All right, that is my riff and my rant for everything tonight. I could talk all night. We'll do this again though. Ryan will set it up again. Tune into the summit, Ryan. Maybe put the link into the chat box again for everybody. Just click on that link. It's not automatically going to charge a credit card or something. It's a totally free sign up for that. They'll try and squeeze some money out of you at some point, whether or not you want to spend it or not. That's up to you. I don't care. It's all just great information from some wonderful people. Again, some of the interviews that I did, specifically Christiane Northrup, like I mentioned, Barry Goldstein was phenomenal. I interviewed some really good cardiologists that were great. My buddy David Jockers, we had some good faith-based conversations there. So it was cool. So anyways, bless you all. Thank you all. We sincerely appreciate your support over here at Natural Heart Doctor. We know you can go to a lot of places for health information and supplements and tests and all that stuff. So again, we truly appreciate you all being here. And don't forget, share the information with people, emails, tell people to join the Facebook group. The more people we get involved, the more lives we're going to save, and that is always a good thing.